This is One on One. Wardell Sanders is president of the New Jersey Association of Health Plans. Good to see you, Ward.
Thanks for having me.
The Affordable Care Act being implemented in January of 2014, one of the key pieces of it is these health insurance exchanges. What are they? Why are they so important? And three-part question.
Right.
Why do so few people understand what they are?
Well, first, few people have actually heard of this.
What is it?
In the next year, you're going to hear a lot about it. And what it is, I like to think of it as like a supermarket for health insurance. So think about this, years ago you used to go to your butcher, you'd go to the dairy, you go to different places. The supermarkets brought that all under one roof. And that's really what's happening with the health insurance exchange.
But
that's
it's
the
online.
Idea. It's online, but it brings together information that folks are going to need. So right now, if you want to get information about pricing, you got to work through an insurance broker. You have to work through intermediaries to get information. The idea was to make this simpler, easier, and provide lots of information that a consumer would want in deciding how to purchase coverage, which coverage to purchase, and then they could go to one spot. They could use an insurance broker to help them through this process. They can go directly online. But the idea is you can enroll, you can check for eligibility for subsidies, and you can select coverage and do this through the exchange.
Whoa, back up. Because I was thinking, it's been said that why don't you compare it to Expedia or Orbitz, right?
Yeah.
Shopping for a hotel or a flight. But there's no subsidy that you're getting from the government connection to do that,
Right.
but you added that.
This is an important
distinction.
distinction.
So I was like, how do you know, because this is a business transaction,
Right.
whether it's for a hotel or a flight, how do you even know if you're eligible for a government subsidy to get the health insurance?
Right, so this is one of the key components of what the exchange is going to do. So when the ACA, when the federal law said you have to have...
The Affordable Care Act.
Affordable Care, when you have to have coverage, but that's unfair to folks who can't afford it. So the law provides for subsidies for folks to help them get coverage. So you're eligible up to 400% of the federal poverty line.
How do you know whether you fall into that?
So the exchange will help you with
By the
this.
way, I don't have the answers. I just keep
That's right.
asking questions.
That's right.
You notice that.
That's right. So what you do is you can go online and you'll plug in certain information about your income. It's later verified, but you'll determine whether you're eligible
By the way,
for a
you
subsidy.
said go online.
Yes.
Assuming a computer.
Assumes a computer, but if you don't have access to a computer, there's other ways to access the exchange. So you can work through an insurance broker, you can call them up, or if you know one, and they can assist you and walk you through this process.
Can you go to the library?
You can go to the library.
Social service agency?
Social service agencies. There's also something called navigators under the federal law, which are entities that are designed, they're paid for by the exchange, and they're designed to reach out to folks that haven't had coverage, community-based groups, work with community-based groups.
Language issues here?
Language, they should be able to assist with language issues. The exchange will select the navigators, but the idea is you want to help folks that are maybe in rural areas that have a hard time getting to information or computers, or folks in the inner city who are having challenges.
Okay, I took you off track. Say you finally, a lot of ifs.
Yes.
Finally you get to the information on the exchange. What the heck do you see on the computer screen?
So, well, we don't know yet because it's not built yet in New Jersey, and it's going to differ by state, but it's not built yet.
Each state, because Senator Joe Vitale, who is the leader of the Senate Health Committee, we've had several discussions with him, together with our working groups with the Healthcare Foundation in New Jersey. We're having these working groups. He's been leading this effort,
Sure.
Again, together with the State Department of Health. Every state will have its own model as to what the exchange looks like, or does the federal government say?
So there's different models that you can select. So you can do a state-based exchange. So New Jersey could build this from whole cloth, and so it has to meet certain requirements, or it could push it off to the feds and say, the federal government, we're not going to select a state-based exchange, but the federal government will run a New Jersey exchange, a state-based exchange, or there's a hybrid model where the state does some functions and the federal government does some
Which
functions.
is best from your point of view?
We prefer a state-based exchange. We think that there are local market conditions that folks on the ground in New Jersey know better. A hybrid change is better. We would be reluctant to have a federally based exchange.
Okay. So go back to the shopping part.
Yes.
Whatever the ultimate model is, a hybrid, a state model, or a federal model.
Right.
You're comparing what? Because I know if I want to fly one airline versus another to go to Puerto Rico or wherever, one flight's $400, the other flight's $300, all things being relatively equal, I know where I'm going. How does this work?
So the first part of this is that the products are more complicated, obviously, than a flight or a hotel. But there is some standardization. So there is metallic versions of plans. So you can get a bronze or a gold or a silver plan. Those are approximations of the value of the plan. And there's some standardization through the certain benefits that are offered in each health insurance plan.
So gold's the biggie.
Platinum actually is the biggie. Right? So there's
so
but obviously it costs more. But yeah, so there's 4 different metallic versions of plans and that will be offered. So from the consumer experience, you've now sort of standardized the purchasing process a little bit to make it easier to shop from
Similar
coverage.
to car insurance?
Really similar to New Jersey health insurance. We've had sort of standardized plans in New Jersey since Governor Florio's reforms in the early 90s. So we've had these sort of standardized packages. They're going to be sort of newer standardized packages.
Okay, so a platinum, you say the best.
Yes.
Costs what?
Well, I don't know yet. There's a lot of
don't knows.
A lot of don't knows in this process. So the federal government is still working on rulemaking. The state is going to have to select what its plan design is, and they will do that by have to do it by October 1st of this year.
Hold, so October 1st of
2012.
Just be clear, we're doing this program right before October 1st. No, it's okay. We always we never try to hide when we're doing the program, but here's the question.
Yeah.
At the pace at which government historically works, or doesn't, we do this program before a presidential election. There'll be a new president or we'll have the existing president. Does any of that matter in terms of the process and the pace at which the federal government works to implement these things that have to be implemented in connection with January of 2014?
Yeah, again, this is one of those don't know questions. It's looking in the crystal ball. But we would say this, is that if President Obama is elected, you would certainly anticipate that the pace and the schedule would continue, you know, along the lines that were set forth in the original law. You know, obviously there is a potential for repeal if Governor Romney were elected. So I get, you know,
but he can't repeal it by himself.
No, he can't. So it's going to be challenging, I think, to repeal. There's opportunities for defunding and so forth, but so the election does matter and how this is going to
But didn't the Supreme Court say it had to be done?
Yes, but a later act of the legislature could change that.
Ward, did you just raise more questions? I know that.
I think I did, yes.
And you're one of the smartest guys we know on this. Is it fair to say, before I get you out of here, that there are many more questions?
Absolutely. So the federal government has to do rulemaking.
Okay.
State decision makers are going to have to make decisions along the way.
Would you stay with us on One-on-One and Capital Report and all of our programs and keep talking about this?
I sure will.
There's more work to be done. Wardell Sanders is the president of the New Jersey Association of Health Plans. Thank you, Ward.
Thank you for having me.
Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, and by Health First New Jersey. Promotional support provided by NJ Biz, All Business, All New Jersey, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.